You're listening to In Network, Nordic's podcast series where we explore healthcare and technology with experts from around the globe.
Hello, and welcome to the In Network podcast feature, Designing for Health. I'm Nordic's Chief Medical Officer, Dr. Craig Joseph. In this episode, I sat down with Brian Urban, Head of Population Health at Best Buy Health. We explored his journey through public health and product development, his experience managing large data sets, and his approach to leveraging new insights to improve patient well-being. We also dove into the concept of hospital at home, the role of Internet of Things, and how a consumer electronics giant is making waves in the healthcare space. Let's plug in. Brian Urban, welcome to the pod. How are you today, sir?
Oh, I am beyond the moon to be on Dr. Craig Joseph's podcast, Nordic Global Consulting. I couldn't be more excited. I'm good.
Now, we discontinued that program where we pay you every time you say the name of the company. I just want to make sure you know not to expect any money for that.
All right, that's fine.
All right.
That's fine.
Now, my understanding is your official title at Best Buy is BMOC for Population Health, Big Man on Campus. How does one get that title? How does one get a job working in healthcare at Best Buy? Let's start from birth. You were born into a family of retail giants interested in healthcare. Is that true? Or am I just making this up?
In short, yes, but you're missing a lot of the good parts.
All right. Keep me up to date. Let's get up to date. How does one get a job at Best Buy in healthcare?
Well, I first got to show off this because you knew I was going to be donning the beautiful colors here of Best Buy on the chest and then also in the hand here as well.
And I've got my Nordic logo here.
I see the swag.
But unlike you, I'm not. You're required to wear that, right? I'm assuming if someone comes to your house, like you have to give tech support.
Me not knowing tech support, I at least have to put on a show, and then I coordinate to the next.
Yeah, well, you're not required to do a good job of the tech support, but you are required to do the tech support. All right, all right. Your shirt looks good. What background do you have that has given you the ability to get this kind of a job? Where did one start?
Yeah, I I'm a bit of an oddball. I am obscure, I think, in most approaches that I take in my day-to-day life, let alone my little career. So I'll give you the quick of it into current time. My first job, actually, out of school was working for Cal Ripken Jr. and Bill Ripken in Aberdeen, Maryland. I worked for them for about a year. That was amazing. That was something I wanted to pursue. Is having baseball as a part of a learning activity for youth and how I could grow my career. Didn't pay very well. Great people, great access to some legendary ball players, but I had to kind of move on into something where I thought I could really make a dent in society, and that's through entering the healthcare ecosystem. And I think you know that obviously with your passion for medicine and your background and where you are now. So I went into the health insurance side of our ecosystem. I worked for Highmark Inc. before it became Highmark Health. Spent a few years there on the Medicare Advantage side, back when there was private fee-for-service plans. So, it was a different time back then in a lot of ways. Transitioned my career to Cigna. I was there for about 8 years. Got a couple master's degrees there, private Christian school locally, an MBA. And then I moved into Walgreens, specialty drug, rare and orphan disease side, where I really started to find my stride. I was studying the different data source vendors out there for how we could put together an SDOH analytic engine that would tell our payer partners and our pharmaceutical manufacturer, life science research partners, what are the social needs that are connected to health outcomes and how can we bridge the gap. And During this time, the global pandemic happened, and it's amazing. Like, I took a global pandemic to shift the way that humans look at each other. That's how ridiculous I think our global society is. We're so short term, especially in healthcare. So, aside from that comment, my work really led me to pursuing a master's in public health. So that led me to Dartmouth College. I was there for a few years, hybrid program. I was there about 5 or 6 times on campus, and was fortunate to bring my family and my son with me so he can experience that school's not scary. It's hard work, but it's a good thing that you can be a part of and maybe make a contribution to a bigger cause. And with my work there, I stood up a data humanity lab in which we were donating raw and at the aggregate level socioeconomic data from TransUnion Healthcare at the time when I was with FinThrive. And that was really, I think, the biggest light for me is, hey, I need to be as close as I can to individuals and make it an altruistic model that has a financial benefit for all the stakeholders. And it was tough for me to do that in the last few roles I was in. So I saw this opportunity through some of the great strategic leaders at Best Buy Health, Diana Gelston, Ben Zaniello, our CEO, Deborah DeSanzo, just the way that they were taking technology and saying, hey, we're not going to provide care, but we're going to enable care to be able to make a real impact in the developing and developed communities across the US and globally as well, but starting in the US. And that just made so much sense for me. And I was really attracted to that. I could just see the potential. So my obscure background has led me to where we are today.
All right, that's awesome. So you really are leveraging kind of your whole history and your scholarship, if you would, to focus you at this point. So kind of give us an overview of what Best Buy. It's Best Buy Health, right? Is that like a subdivision or?
Yeah.
Okay, so just a division of Best Buy focused on health. So what is it that you do with respect to Pop Health? Kind of where's that overlap?
This is cool. This is where technology stops being nice, Craig, and it starts getting real. I think I took that from something.
That sounds like MTV, but we'll go with that.
So this is it. So Best Buy is a huge enterprise, global presence. It's had a really interesting history through its birth and its acquisition of the Geek Squad over 20 years ago, and then now the birth, and skipping a lot of history there, of Best Buy Health in 2020. So it's coming to about really 4 years of life, and through a few series of acquisitions, we are now one Best Buy Health. And our technology is really the sweet spot of where we are. So it's the remote patient monitoring and personal emergency response devices that's powered by our caring center that we have over 100 folks across 5 sites in the US that respond to clinical emergencies and non-clinical emergencies, a lot of non-clinical emergencies, really social health, daily living challenges. And then our clinical command center, which is just the expertise of synthesizing data from remote patient monitoring devices that goes on our dashboard that we then share out to our healthcare system partners. So it's really enabling the care systems in place regionally, in a community sense, and nationally to be able to have the best impact they can for people aging in place that might be elderly, frail, managing a lot of conditions that are a fall risk, that don't have close to kin or family nearby, and they need frequent touch. And I think this kind of idea that's really making an impact, and we're still quite young, but it's the idea that technology is going to not only provide capacity for a lot of models that need help today, like the PACE model, like clinicians going in homes, gerontologists, PCPs. We're gapped right now. I don't know how we're going to fill that gap human wise, but technology has to be adopted to be able to bridge a little bit of that and also make us all more healthcare utility players in the same sense. So that's my take from coming into Best Buy Health, and that's how we exist today. And there's just a ton of beautiful stories that we have right now with our existing customers and where we're going to be going in the future as well.
Well, what are some of those stories? How if I'm just I guess I'm a patient who is getting discharged from the hospital, and someone mentions Best Buy to me, that's going to be a little bit shocking. Are they going to mention you by name, or how does that work?
This is a good example. So when we think about chronic care management, we're not providing that care, but we are an accelerant to it through the technologies I just mentioned. Transitional care in particular, when we think about populations that are either having a joint procedure, whether it's an acute injury or if it's a replacement, and they're going home, they're absolutely a fall risk for a certain period of time. And if they're managing other conditions that require multi medications or other complex treatments, you can think about respiratory, cardiovascular, metabolic, in particular, the diabetic population, needing a consistent remote monitoring of their conditions, especially if they're on new medications when they're transitioning home. And a hospital or a system like a PACE model might not have the ability to have a daily or weekly touch point with them. You have this technology that is very user friendly. The Geek Squad enables it, installs it, and services it for individuals. We had over 40,000 of these touch points just last year. And we're going to have continually more and more of those as we continue to scale our efforts logistically. So that's kind of an example of the transitional care when someone's going home, how we marry a technology to their needs. And then we provide digital literacy as well. So we actually educate them on a continual basis of how to use it. And then we also bridge things like connectivity. So when you think about folks not being able to, my mother-in-law in particular, maybe she'll hear this podcast, maybe she won't. She has a lot of challenges using her general hardware, let alone understanding Wi-Fi, which is very new to her in rural Pennsylvania, even though it's been around for a long time for other parts of the developed acute counties in Pennsylvania. So that and all the way up to social needs is something Geek Squad is starting to address. And I mean, going the threshold from doorstep to in-home, that's invaluable. And that's something I'm attracted to of how we can really start to help people and not try to bid for trust as currency in healthcare, but actually already be a part of it.
So how do you had mentioned that your CEO was very clear, like we are not providing care, we're enabling care. Where's that line? Sometimes it's a little unclear, right? So if the monitoring device, let's just say it's a scale, it's I've got congestive heart failure and my weight's been going progressively up, which can be a sign that I'm in some sort of exacerbation. How does one decide? How do you get that information to the people that need to hear it? How do you know when it's something actionable or when it's not?
Yeah, and it varies by population and by partnership that we have in the healthcare setting. But in large part, when we have data that's continually flowing from RPM remote patient monitoring devices back to our dashboard that our clinical command center sees, they're trained not only from their clinical licensure and their experiences, but they're also trained into how to either alert as an urgent or send trend information to the appropriate healthcare providers or care managers on the healthcare system side so they can take the appropriate action. So really in this scenario, we're the care orchestrator and we do it at the frequency and the immediacy based on the population and also based on the partnership that we have in place with the healthcare system. So like Atrium Health, we've been with them since the very beginning. They're most scaled at in-home care programs. So it's very routine for them to be able to take us in and kind of guide us. So that was like a big deal for us. And now that we've grown into healthcare, we've had so many different use cases that are in hospital, also the acute hospital at home program, which I believe is going to be a staple through our regardless of any administration coming in the presidency, it's just something that's proven the value to all stakeholders, especially with an aging population. So like those types of models we've been pulled into because of great partnerships like that.
Yeah, hospital at home. It sounds pretty simple until you actually start trying to do it, right? Like I've heard about requirements for electricity and other things that seem like, oh yeah, well that's a big wire that needs to, be connected. So the more you think about hospital home, the more complicated it gets. But to your point, a lot of us, I think everyone would rather be at home when they're healing. And if you can do it, but still need, can get away with just having a nurse come once or twice a day, it's definitely something that we're going to need to continue to do. And so that's a lot of what you would do as well from the Best Buy perspective, it sounds like.
Yeah. So looking at the landscape today in the acute hospital at home program, it's across about 37 states, well over 300 healthcare systems and standalone hospitals. So it's been well adopted, not only as new monies and new ways to engage patients and control utilization or appropriatize utilization, but it's made more sense economically to shift the alternative point of care to be at home. So it's no longer a rural play. It's no longer a population that is what you call designate as DSNP. They're on Medicaid either for cognitive or physical challenges. It's for so many different use cases across so many different populations, really 40 and above. And there's a lot of pediatric use cases as well that are growing out of children's hospitals. So it's something that I see so much value in. And I think in terms of the other side of the house, health plans see a lot of value in it as well, because I worked at Cigna for a long time. Hi, Mark. Not many people want to willingly engage with a health insurance organization. Straight up. That's it. It's not like they're bad guys or bad folks, but it's just it's not of a value or an entertainment factor that really pulls someone in to talk about their health or their needs with an insurance plan, because there's a trust barrier and it's always been there. But when you have an organization like Best Buy come in and they're doing work with the acute hospital at home program and they're working with healthcare, it helps bridge the gap with the engagement to health plans as well. And it's just, I think more health plans, the really effective leaders, the next generation folks, are thinking about strategic partnerships in that way and not just vendors. They're thinking about who's a long-term partner that comes in and knows the community like we do, especially if they're a Blue Cross Blue Shield licensee, and that can come into a home and do a great job. And they're not at risk of any really scary things happening to them. It's not a gig, a contracted economy that we work in. These are tenured Geek Squad. These are tenured technical folks and tenured social health workers too. So it's quite a fascinating evolution that this acute hospital program at home has really changed the landscape in a lot of ways.
You mentioned trust. That one of the benefits of having someone from the Geek Squad pop in and help you set up whatever you need from a patient perspective. Hey, I've heard of Geek Squad, and there's some trust there. There's been some struggle on the retail side of getting into healthcare. Are there? I'd like you to name specific names. Has Best Buy, or do you think Best Buy is learning or has learned from some of the stumbles of other large retailers across the United States in their attempts to become more involved in healthcare?
Yeah, I think it's valiant efforts. I speak to my Walgreens brethren and their investments, CVS as well, Walmart. They've all had a really great engagement rate and trust factor, as I was mentioning before, as like a currency in the way that you can continually build new relations and delight and surprises for your customers. But going into healthcare, as you know, it's a different ball game. And working with payers, welcome to the jungle. Like, this is very different. There's a different Department of Insurance at every state, the way that you file and contract with providers. There's federal guidelines. And then also, this changes every 4 years, sometimes in a big way, sometimes not in a big way, depending on the administration. So there's a ton of complexity to think about in a short and long range plan from a retail perspective when you want to deliver care. So the low hanging fruit, it seems like, hey, let's be preventative. And then the big cost savers, you want to work with populations that are taking very expensive medications or are dealing with rare disease or that have multiple conditions or fit into a variety of other boxes that would make someone think that they're of a vulnerable, high need population. So there's a lot of different perspectives there, but I think what we've taken a look at is saying, we shouldn't be providing care. Our mission's pretty straightforward, at least with Best Buy Health, among other retailers that are thinking about getting in healthcare. And that's quite simple. It's to be able to have our technology be at the center of all things. And the mission itself is we want to be able to enrich and save lives through technology and meaningful connections. Like that, those words are very simple. And they're not so aspirational that we can't reach it. It's something that we're already doing on a daily basis, but we're not providing care. When you start to cross that threshold, you as a business become very vulnerable to the forces that are outside of your control, not only from a policy perspective, but if you're dealing with large private health plans, the way that they contract reimbursements at a rate sheet level, all the way up at a population level, it's very, very different. So we learned that our technology and our logistic and fulfillment is our secret sauce. And let's stick with that. And I think we can make the back end impact to what healthcare can follow through with. And that makes sense to me. And I know that we're not going to ever provide healthcare. And that's a very strong statement from our CEO and from our chief medical officer. And it makes sense with where we are. So that's kind of how we've seen it personally. How I've seen it is partnerships have to be key, and populations are very important. When you can show that you're having an impact economically from a balance sheet with healthcare utilization and engagement and experience at an individual level, like that's where things start to really change, and you can find your rightful place in healthcare as a retailer. But until then, proceed with caution. That's what this has told me.
That makes sense. When we were preparing for this conversation, you had mentioned the word disruption is not high on your list of words you like to use, because it kind of sounds like that's not a bad word for what Best Buy is trying to do and others in terms of, hey, it is a big disruption and we're doing it from within in terms of sending patients home to do to continue their hospital stay, but not in a hospital, or avoiding the hospitalization altogether. And can we send them home from the emergency room as opposed to sending them upstairs to a bed that may or may not exist? Certainly sounds like disruption to me. What's a better word, or how do we use that word to not cause bad things to happen?
Yeah, and this kind of goes maybe to my philosophy of being such an oddball. Is I'm not a big fan of trends. Most trends, I think we're past the maturation point of being disruptive, like breaking stuff and working quick. Sure, like that's fine. But how many damn things are we going to break until we have to start from scratch and build something new? So I think unifying the things that need to be functioning better makes more sense if we just take a look at it practically. I don't think that we have a crisis in healthcare in the US. It's a current malfunctioning in operation system that is very advantageous to certain parties, mainly those that have heavy lobbying power in DC, that write mandates, that can vertically integrate and keep people in a network and have them be able to be confined to how they access healthcare and spend their dollars and engage in healthcare. That's just the way it's gone in the US. It's a capital system. It's not horrible, but it's created these huge gaps in our society of who can access care, who can afford it. And right now we need to start to just unify things instead of constantly breaking things until they're out the little teeny bits, and then we have to build things back together. So I think we can be a little bit more practical and work through the existing model in the US of healthcare and how things are paid for and how services are rendered, and just start to fix things together by stitching stuff. And I think technology is a big stitch that can go in and unify things, especially from a hardware, software, underwear perspective, that being the people force. So it's like more of a time that we need to unify stuff than constantly be battling Big Brother and trying to break things.
All right. Well, you mentioned technology, and you mentioned hardware, software, and underwear. And that brings me to my next question of Well, what is new in remote patient monitoring? So I gave one example of a scale, um, and there's a blood pressure cuff that automatically uploads, some numbers. You mentioned underwear. Is that just a was that just a poem, a poetic moment there, or
That was just a fun phrase that I took. That has nothing to do with what.
I feel like is there going to be Best Buy underwear that is connected to the internet?
I don't see it happening, but I'd be happy to be a guinea pig. But no,
I might buy that. Well, are there new things like what are you guys installing in people's houses besides blood pressure cuffs and scales? Because I think I can handle that.
yeah, I think you could too. It's simple stuff that exists today: glucometers, blood pressure cuffs. If you're familiar with the Aurora Ring, heart rate, sleep, all these devices almost do the same things as each other, except some are quite niche than others. And one device might be able to track sleep better, and then one might be able to also track sleep, but track heart rate better. So there's different things that all almost overlap in this technology Venn diagram that we're seeing in this continual evolution of advancement, device wise. And I think the power of scale, speed, and AI are only going to add to that. But the newer things that I see happening is the way that our model is being put together like puzzle pieces that can suit. We're not going to be for everybody. And I think, quite frankly, it kind of makes sense to be for everybody, but that's biased. But I think there's a lot of health plans in particular that whether they've been at 4.5 stars or they're at 3 due to recent changes that they might be struggling through or wanting to take action on. But there's a clear sign that the landscape is going to change over the continued administration and then the following one and the following one. And to be able to be prepared, let's not just simply take legal action. Let's not just simply continue to acquire other companies. Let's find long range partnerships from a technology side that you can feed insights into, that you can co-develop things. So I couldn't tell you our roadmap in terms of devices, but things are going to be more sophisticated and stitched together to help address, for me, the underlying human condition and the social health needs that are directly connected to urgent or chronic healthcare needs for an individual, let alone a population in developed and developing communities in the US. So I think that's a large part of how our model is going to be more next generation. It's how we're using our logistics, fulfillment, device, and people force as this really cool combination to fill a lot of cracks that I see out there that inherently a lot of health plan leaders have on their plates. They're trying to figure out how to work with.
Sure. Yeah. It's kind of magical, some of the things and that are happening. And I'm not sure if it's remote monitoring, but thinking of, hey, did grandma open the refrigerator in the last 24 hours? Because if not, there's a problem. Or did someone who's struggling with depression leave the house? We can know that maybe by whether the door is opened or whether the phone, which is usually with us, has left the house. And so those kinds of things I see. And the good news is that's a lot of data that we can use to determine how to kind of, if people are in trouble, and if so, how bad. The bad news is it's a lot of data. And to your point, like you need an artificial intelligence or something akin to that to be able to kind of look for things that are out of the norm, and then kind of tell the appropriate person who can reach out and figure out if it's a real problem, and if so, how to address it.
Yeah, I think to maybe where you're going, no matter what, we're always going to have very skilled, licensed healthcare professionals in between a device, the data that's coming from it, and then to the next party or platform that it might be going to, because you still need a real person to be able to synthesize, is this an emergency? Is this a trend in this person's biometrics that's saying, you know what, they're at risk for a stroke. We need to get ahead of this. We need to adjust medications. They need to see one of their specialists immediately. So I think that's also part of the secret sauce that I've always seen in Best Buy Health, aside from being able to go in home and help people from what's always a confusing, like technical perspective with, Wi-Fi or devices, or how they in home can start to use different things to communicate with their family abroad. That's always made sense, but I think the human part of it's always going to exist. No matter how many holograms we might have out there that might pop through devices in the future, and how smart a smart home might be, people are still going to be needed to be in between some of that info flow.
So, Brian, we like to talk about design at a high level here. How do you incorporate some of the basic principles of design in the work that you've done in the past, or that you're doing now with Best Buy?
Yeah, this is a great question. I think at the center of how our philosophy is evolving toward new partnerships. So, in the past, a lot of my work has been direct, working business to business, but strategic partnerships and alliances, especially when you're working with a population that overlaps the type of care or technology that you provide, makes a ton of sense. And I think when we look at Best Buy Health and the trajectory we have, not only with our people force, Geek Squad, but also our device and the engagement rate that we have, I think the next obvious place for me when you think about population health is kind of the new iteration, kind of this third peak of population health that's grown out of academic medical centers and clinical practice and research, data, SDOH, policy, and then now really technology is kind of the next obvious peak for pop health. And thinking about that from a design perspective, it's how are we engaging populations with high need that are aging in place, that have a lot of clinical challenges or need continual monitoring from clinicians or from social workers, that can be done in part through technology. And that right there is the center, I think, of the next iteration of pop health. So it doesn't stay stagnant in where it's been in academia and clinical research and really in the medical setting, which is fine, but it needs to grow and evolve just like all things have in medicine and technology. And now having this as a third iteration, at least for my design focus of how we're approaching some of the different things that we can puzzle fit to help a population, whether it's managed care through a health plan, through a healthcare system, an IDN right there as well, or even out into life sciences, how clinical trials are being monitored and how drugs are being developed. There's a world that's just beginning to open up for what I think, from a design perspective, pop health needs to be at the center at with technology.
That's great. Well, this has been a super interesting conversation. I love the Best Buy shirt.
I didn't have the collar pop. I should have had this pop the whole time. It's too late now.
We'll go back and we'll use an AI to make it look like your collar was popped.
Fix my crooked nose too with AI if you get the chance.
Also, we will make you taller. We will make you taller. We like to end all of our interviews with a question about design and anything in your life that's so well designed it brings you joy whenever you interact with it. So there are one or two things along those lines.
One or two things. You don't know this. I don't think you know this. I'm not sure if anyone you've interviewed has gone this direction, but I have a lot of chickens. I have a lot of ducks as well, and we have a little what we call community farm. And
you live in Manhattan? That's
I could not live in Manhattan. There's no dirt there.
Okay.
Yeah, no, I don't think I could survive in a city. I need dirt. I need a lot of dirt and snow. I don't think Manhattan even gets snow. It's too hot down.
Wow. All right. So, I took you off. So chickens and ducks.
Chickens. Yeah, so my son and I, and my daughter's quite young, but my son and I, he's a professional chicken wrangler that
okay.
I'll call him. But he and I take care of the birds almost on a daily basis because you upkeep it. And this as a nonprofit, it just started out as a fun thing. And I don't think any of your guests have maybe gone this far, but I'm thankful to say I'm 7 years deep in sobriety, and engaging with domesticated farm animals has been a large part of helping my little brain through a lot of my continued academic work, through my family life, through my work life, and through just living a clean life. And I think the fun part about having this little project and going out of control is now we get about 30 or 40 eggs a day. So
Wow.
we donate those eggs 100% to a campus that serves women, children, veterans, and homeless next to the county jail that's in our county. So we go down there, drive about a half hour every Friday and donate eggs. And it's feeding over 100 families a month. And they don't get fresh food. And now my son can see that. So, whatever he chooses to do in life, lawyer, doctor, business executive, whatever, like that's getting in the dirt and being with animals and seeing the downstream impact of how a little farming can help other people. And you don't put a cost to it. Like that's, for me, that's where I get joy. And I love it. So, if anyone has a little bit of land and they can get chickens, do it. I highly advise it. It's a good thing when an animal looks you in the eye and they just, they care about you and they need you. So that brings me a ton of joy.
That's awesome. That's intentional design right there.
Yeah.
For real. So awesome. Well, thank you, Brian. That was great. I really enjoyed our conversation, and I want to thank you again for your time.
Thank you. This has been an honor to be on the list that you've interviewed.
Oh, you're on it. You're on it now. You're on it.
I got to get you an official shirt. It's coming in the mail.
All right. And we will make sure not to post this episode until the shirt comes in. So,
all right.
So, dear listener, if you're hearing Brian's voice, you know that I have received my Best Buy shirt, and I might be doing some freelancing as well. I'm not very handy, but I try.
There's always room for another chief medical officer.
On that note, thank you again, Brian.
Thank you, Dr. Joseph. This was awesome.
Thanks for tuning in. We hope you enjoyed today's episode. For more on Brian, follow him on LinkedIn at linkedin.com/Brian-Urban. Check back for more episodes of Designing for Health wherever you listen to podcasts or on NordicGlobal.com. Till next time, we'll see you in network. If you enjoyed this episode, please leave us a 5-star rating and a review. This helps others find the podcast as well.